You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Kyle Kiser, who is the CEO of Arrive Health. Welcome to the show, Kyle.
Happy to be here. Thanks for the invitation.
Yeah, good to have you here. So if I like to start off every episode by my guests being able to tell our audience a little bit about your background and what you've been innovating these days.
Sure. So my personal background is I came out of the health insurance business. I grew up in that world, and my family's businesses were benefits brokers and benefits consultants, and working with employers to try and help them save money on their benefits. I had an opportunity to stay in that space, came out of college, worked for carriers, and I think got the bug to, try and impact spend in a little bit more direct way, right? Is that whether you work inside of a carrier on the commercial side or you work in a broker or consultancy, it sometimes feel like you only have two options, and it's to kind of shift costs to the employer, shift costs to the patient. Didn't seem like it had to be that way. And so that led me down a path. Focused on corporate wellness for a while. So they're part of a Principal Financial Group, and they had a wellness company inside of the big financial services business. Got to be a part of what felt like sort of an internal startup in that environment. 50 or so people focused on this wellness effort inside of the 10,000s of people working in the 401k business. They had a health plan at the time too. I moved to be an early employee in startups from there, both in wellness and primary care at the work site. It just sort of got the bug for the early stages of a company, especially in healthcare. I love systems and love to sort of think about how things fit together and why people make decisions the way they make decisions. And if you enjoy observing that, then healthcare is the most complicated and interesting thing you could ever observe, because there's a bunch of bizarre incentives that when you look at them really up close, make a ton of sense, right? Like you see person A is making this decision on behalf of incentive A. When you back up and look at it from a systemic level, it's chaos, or it feels like chaos. So find the healthcare value chain fascinating, and wanted to go earlier, and became a part of RX Review, now Arrive Health. We've recently gone through a rebrand, almost 8 years ago. Been a part of it since the start and since the initial commercialization, and been at it ever since.
So you mentioned the rebrand. So let's just let's just dig into that right out of the gate. So what was the trigger for this transition?
I think there's a couple of things. One, it's in the history of the company, I think as a matter of background here, what we do is we connect real-time patient-specific and location-specific price information into clinical decision-making processes. So we do that by building relationships with health plans and PBMs on one end of our network, and then connecting to EMRs and provider systems on the other end of our network, so that a provider, when seeing a patient, can understand the cost of a medication or a different procedure, understand the alternatives that might be relevant based on what we know and what we've worked with their PBM to understand in the case of a drug. Those come in two forms. Might be different drug, might be a different pharmacy. And so the reason that background matters is the vast majority of our work to date has been focused on that. We have also done work around medical benefits, and medical benefits is on the same glide path that drugs were. It's probably just 5 or 6 years behind it, where now we've gone from 5 or 6 years ago, real-time benefit was one of those things where we were having to describe what it was, how it worked. It was missionary work. Now, CMS has a mandate that every Part D plan has to provide a real-time benefit tool. Medical benefits, I think, is in that same evolution, where there are some ambitious health plans that are working on point-of-care connectivity for pricing things beyond medications. But it's fairly inconsistent. It's in its early days, and there's still a lot to learn about both how it's implemented and how it's executed. And I think that's the future, right? Is that there's not going to be a future where your provider sits in front of their EMR and doesn't understand the impact of cost impact of the clinical decisions that they're about to make. And frankly, that's the way it should be. It's the only type of commerce in America where someone else makes the purchasing decision on your behalf, and you have no idea what it's going to cost until you sort of after the fact or until you're standing at the pharmacy counter. So the reason for the rebrand was, one, preparing for that inevitable future that, this is going to expand beyond medications, and our name was very focused on medications. The other is around decision making itself. Largely, we've been focused on the point of care and informing the point of care. We're expanding beyond that too, and involving care teams, engaging directly with patients, and really see ourselves as the decision platform, right? Like we're building the platform where there's an important healthcare decision happening in the patient's life that we can engage the care team, we can engage their provider, and we can arm them with the information that they need to make the right decision the first time. And so we feel like Arrive Health articulates that vision much better than sort of the discrete and specific RX review, which was a drug and a very specific verb. In Arrive Health, we're focused on clearing the way for better health is the mission of that work. And I think that means protecting that encounter to focus specifically on patient health, to focus specifically on solving the problem. And then us doing everything we can to ensure that the right options and affordable options are at the fingertips of the folks that need them.
So that makes a lot of sense. And I think that is something that, commonly happens, once you enter the marketplace and start to evolve and expand, that you might outgrow that brand. And so it makes sense. So as you're kind of describing what Arrive Health is offering in the marketplace, how would you compare what you guys are doing to something like GoodRx?
That's GoodRx is a partner of ours. So think of our network is on one side of it. We think of it in the terms of supply and demand. So on the supply side of our network, there's insurance pricing, there's discount card pricing, there's cash pricing, and there's other sorts of forms of assistance that may be relevant. On the demand side of our network, there are decision makers. That might be a provider, that might be a care team, that might be a patient. And so, we're the network that's managing that marketplace of supply side information to the distribution of decision makers as they're facing a decision in real time. So GoodRx is a discount card price. So they're a specific version of a PBM price. One of the things we found is 40% of the time in our transaction base, there's not an active insurance eligibility present. Right. So we can't derive an insurance price. So we look to partners like GoodRx to put forward discount card prices so that we're able to give some indication of what that might cost and provide something of value to both the provider and the patient that they can then move forward with.
Makes sense. Yep. So let's kind of start back to the earlier days of this commercialization journey, regardless of what the brand name was at that particular time. But as you're kind of like reflecting back on that journey, what were some of those key decisions that you made along the way that ended up being game changers for you when you think about the business of bringing these innovations to market?
Yeah, absolutely. Let's see, a few things. One, we initially started as a patient-facing technology. We were going to be an API company that sort of helped inform pharmacy decision-making for patients. Pretty quickly learned that the pricing data was pretty hard to come by, and we needed to do things of value for those data sources that they would find important. At the same time, we started partnering with UC Health in Colorado, in Denver, the Care Innovation Center there. Rich Zane, who's on our board today, leads that Care Innovation Center, and that became a really important partnership for us because we started to work with them on decision support applications and really focusing heavily on provider behavior change and what it is that motivates provider behavior change. And that shift from sort of consumer-facing tool to point-of-care tool, decision support tool, understanding provider behavior change was the first of several game changers for us. But the first and monumental one is just to understand, who we need to influence to actually add value in this really complex value chain. It was that, the pricing data was around, it was somewhat accessible if you were working with the right partners. But we needed to be solving their problems. And what PBMs were facing at that point was relatively low engagement with some of the real-time benefit tools. Because of the work we were doing with UC Health, we were seeing some pretty high engagement based on the approaches we were using. And so that pivot from member patient facing to point of care was a huge and important change for us. That's where we established our initial relationships with both PBMs and providers. So that was a big part of our story. In the early days, we were also trying to sell some of those decision support applications to providers directly. We had a little bit of success there. I think the challenge was, the provider is not the beneficiary of an optimized prescription in an outpatient setting, right? The risk-bearing entity is.
Yeah.
And the sort of shared risk environment at the time was relatively nascent in a lot of health systems. I think a lot of folks would argue that it's still relatively nascent compared to sort of fee-for-service as it exists in many places. So making sure that we could align our business model with who benefited from our effort was probably the second most important thing, is that, selling to provider systems on behalf of an optimized outpatient script was to, in some ways, a fool's errand. We learned a lot, but we needed to then shift our business model so that health plans and PBMs and risk-bearing entities were the ones paying for the active utilization of provider. And that's where we sit today. This is payer PBM paid and used by providers inside of their EMR, influenced by our tools. And that sort of alignment of the business model was probably the most important change for us.
Eureka.
Yeah, right.
Right. A long, hard slog to getting to that point.
It was. Yeah. Looking back, it's simple when you say it out loud from this spot, which is like, we just need to, charge the folks that benefit from the script being less expensive. But at the time, you sort of just trying to get a deal done.
Right. Yeah, absolutely. Yeah, it's always a different point of view in hindsight.
Yeah, totally. Armchair quarterbacking is much easier than being actively rushed.
So what would you say is the number one commercialization strategy that you guys have deployed that's led to your success that you have today?
I think it's just sort of what we just talked about, right? It's obsessing about the value chain and understanding in what context you're operating and who benefits from the actions that you're putting forward or the technology that's being used, and aligning the business model to make sure it's appropriately in step with the way the world works, right? To the earlier comment around the healthcare value chain, is that it looks complex, it looks irrational at times, but if you really sit down and obsess about sort of why does this entity do business with this entity and this entity do business with this entity and how they all interconnect, it makes sense why each of these discrete entities start to behave the way they do. And the truth is you've got to some degree align with the way the money flows today, and over time you can impact that on behalf of whoever your mission is. But you got to understand the way the money flows and who benefits, and you got to use the tailwinds where you got them.
So speaking of mission, you and I were talking earlier, and you had mentioned this phrase or term, "Lucy Up."
Yeah.
So tell us what this is. Lucy Up is all about.
Yeah, happy to. So one of the co-founders is a guy named Kevin O'Brien. He's a doctor in Denver. And Kevin's really the spark that launched all of this. He was practicing in his practice in Denver, seeing his patients, and he started to manually curate all of these ways to save on medications as a part of his own effort. Not because anybody's paying him, not because even he was in a value-based relationship. Frankly, he was probably spending too much time on this stuff and would have made more money just pushing patients through the door. But Kevin started doing this stuff manually, and it was largely inspired by a conversation he had with his mom. And Kevin's mom came to him and said, "Hey, I'm a Medicare member. Prescription spend monthly is out of control. Can you help?" And any good son with a doctoring skills would have done the same thing he did, I'm sure, but looked at her meds and said, hey, this one you can split. It's a brand, you can split into generic parts. This one you can pill split. This one has a therapeutic equivalent, and optimized her medication regimen and cut her spend in half. Didn't change anything about her outcome, didn't change anything about even the medications,
Wow.
the molecule she was taking, right? And that inspired him to start doing this in his clinic and start to accumulate these ways to save on medications. So all of that is the origin from which we come. And Kevin's mom's name is Lucy. And so we have a mantra in the organization and have for several years now that's Lucy up. And it's sort of the way we tell each other to sort of focus on the mission, or when we're too tactical, we're too in the weeds, we're too focused on sort of whatever the next task is. Lucy up's a way to remind ourselves to lift our eyes to what we're really here for, and frankly, I think personalizes the mission for everybody, because everybody has a Lucy, right? Like there's somebody in your life. It might be you, might be somebody you love, might be we were talking earlier about some of these things in our own families, and everybody's got a Lucy. Somebody's had an experience with the healthcare value chain that just didn't make any sense, or was completely complicated or irrational or hard to get through or expensive. And those stories are not hard to find. And so Lucy Up's a way for us to all personalize that within the company, to know, like, I show up for my grandmother, I show up for my own experience, I show up for my mom, I show up for my sister, whatever it is. And it's a way for us to make that a part of the way we do business and the way we show up every day.
That's awesome. That's fantastic. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. Obviously, affordability and accessibility to care are is where a lot of the friction and pain of the healthcare journey really is. And it's great to see people like yourself, scratching the surface and trying to solve for that problem. But we still have a long way to go. I was leading a patient co-creation project several months ago for a client where we were collaborating with patients and really wanting to understand their perspective of success in the healthcare journey. And some of their number one complaints really consistently across the 150 patients that participated was the challenge with health plans. And, their doctors prescribing treatment that they can't afford or that they can't access. And, especially some of these patients are oncology patients. So their lives are online. And so it's just frightening to know to not be able to have control and to not be able to participate in that conversation and to be able to make better more informed choices for yourself. So it's great to see what you guys are doing.
Yeah, glad to hear that. And what's interesting is that it's a problem that is entirely solvable today. And that's what I get excited about is we've just, historically said yes as a system to, on one end of it, health plans are making reasonable rules to help manage risk. On the other end of it, providers are making reasonable decisions based on the clinical information they have in front of them for what they know about the patient. And in a ton of scenarios, that clinical decision and those rules that the health plan has established have a happy path. Like there's a way to rationalize that. And it's frankly not happening just because we don't have the right information at the right point in the decision process. So we've just started to do some data mining to write an article about just how often $0 options are available. So there's been a lot of publicity lately around large health plans saying we're going to make, insulin $0, or we're going to make generics $0. Mark Cuban's initiative to make everything a little less expensive. It's a good thing, whatever it may be. But we're digging in to understand, like, how often is an expensive decision made when there was a $0 option available. And one of the examples, I'm a parent of young children, so I guess this one's on my mind for that reason.
Yeah.
But, if you're a parent, then at some point albuterol comes into your life, right? Like there's a inhaled steroid to help get your kid over a cough, croup, or whatever it is.
Yeah.
Well, albuterol comes in sort of half a dozen different forms, right? It's a disc, and it's an inhaler, and it's sort of, you can get one of the nebulizers to use it, right? Well, health plans have really specific opinions about which one of those you ought to use. And most health plans probably have a different opinion about which one you ought to use. And providers have absolutely no way to know that without a piece of technology like ours, right? So you choose the wrong albuterol prescription, and it's $250 a month. If you choose the right albuterol prescription, it's free, right? Like it's the difference between $250 a month and free. For a lot of people, that's the difference between actually getting that medication or not, or having to bear undue financial stress to get your kid healthy.
Choosing between groceries and money. Groceries and medicine. Mm-hmm.
Exactly right. We've got somebody on the team that it reminds us often, like what's in front of us is the choice between, can you put food on your table, or can you get the meds your kids need? Like we're doing almost 100 million transactions a year now, and that scenario absolutely exists within that transaction base, and that's important work.
So how much of the market have you penetrated so far? And kind of what's next for you guys?
We've on the health plan end, we've got 150 million members in our network that are addressable. That means we can send a transaction and get a response, a cost value back that's specific to that patient. On the provider end, we work with Epic, Cerner, and Athena are the EMR platforms that we work with. And we'd love to expand that. So what's ahead of us is one, EMR expansion. Those represent a little over 300,000 providers that are addressable in that network, and a couple 100,000 on a monthly basis. So what's ahead of us is expanding both ends of that network for sure, right? Is that we want to continue to grow the health plan end so that it's always relevant when a provider uses it. Continue growing the provider end of that network, because that's sort of how we grow transactions and how we impact the most decisions. I think a few things are ahead of us. Is one, at our core, what we do is generate a specific price based on what we know about that patient's insurance. That's always going to be a really important part of what we do, is understanding the complexity of their insurance and putting forward the best insurance price possible for that patient is a big part of what we'll do. There's a bunch of complicated things associated with doing that well. And then I think the other is really optimizing alternatives and putting forward the best alternative for that patient. So being able to say, and in most cases, right, the insurance price is your best price, and we want to drive compliance with plan design, and we want to drive compliance with what's right based on the benefits that they've been paying into, right? And you want to maximize your premium dollar. And in a lot of cases, pharmacy selection can make a huge difference, and we want to understand where the most affordable pharmacy is. So a lot of times, the PBM mail order is a really good choice for that. We will put those things forward. So more intelligence around best insurance price, most intelligent alternative, and really expanding that into the hands of patients, and knowing that none of that stops when the provider makes that decision. And ultimately, you got to understand affordability based on insurance, but you also have to understand what programs are out there to help them pay for the med if they need it. How do we start to onboard folks into medications in a faster way? Because frankly, once that decision is made, regardless of what the medication is, there's a complex path in many cases between that decision and the patient actually getting the medication. And we want to automate as much of that process as possible, so that patients can get on meds faster, they can access medications that they may not go through the hassle to access in today's environment. So really, it's starting to automate more of that process is what we're focused on.
Are you thinking about retail pharmacy or specialty pharmacy or a combination of the two?
Combination of the two. Most of our work today is in pharmacy benefit. So there is specialty as a component of pharmacy benefit and clearly a lot of retail, but and we are also starting to do some work in medical benefits and want to expand that work as the industry is more capable, but it's both.
Mm-hmm. So we've had a lot of conversations on the show about data and just access to data and interoperability or integration of data. Talk about some of your challenges and maybe some of the things that you've been able to overcome in your journey.
Sure. Yeah, I think initially our biggest challenge was just access to pricing information. I think we talked a little bit about that, and it's just understanding the stakeholders and understanding how you contribute value to them or not. For us, that became payers and PBMs and wanting to work really hard on behalf of their interest to drive provider decision-making in a lower cost direction. And that's what it took to get access to that data. The EMR was a different and equally challenging aspect of this. And so for us, similar story, different stakeholder. We work really closely with provider organizations. We have strategic partners and investors that are providers. We did that very intentionally. We wanted to understand the problems they were trying to solve. We wanted to understand the systems that they use. We want to make sure that we are building things that are provider-centric, that providers trust, that providers will consistently use and ultimately change their behavior on behalf of. So that was a really important strategic step on the path to getting access to provider systems, EMRs. And frankly, we have to work really closely with those partners as basically wet labs for new functionality, right? Like we want to do something new in an EMR. We work with UC Health and we work with Unity Point, or we work with Providence to do it there first and learn together and then launch it into the market, because you kind of have to have that to get these things done.
So we talked a little bit about, I don't want to say we've danced around it. We've talked about it, the idea of your business model being a network, a platform business. Talk about some of the challenges of this balancing the supply and demand side with two different groups. And then, some of the advantages of having a platform business in the long run.
I think that's an interesting question. There's a bunch of ways to answer that. I think one of the challenges is being able to really clearly answer who your primary stakeholder is. And when you're in this business where your users generate revenue for you through their utilization, but they're not the ones paying you. And then supply side inputs are the ones paying you based on the behavior change of users. You have to really carefully think about the incentives that are in your business model and who you're doing that on behalf of and who you're closely aligning with. For us, our economic buyer are those supply side inputs. But we decided that the most important stakeholder for us was the provider. Two reasons. One, that's the most leveraged relationship in the supply chain. Patients trust their provider. They understand that that's who's making that decision. When you have a question about your medication, you go back to your provider and you ask that question. You don't your first instinct never to call your health plan or your PBM. And maybe it should be, but it just isn't, right? And so that was reason one. And the other was just for us, it seemed like the individual provider is this sacred encounter with the patient that is more often than not uncorrupted by any other interests, right? Like they're not trying to necessarily fill the script. They're not trying to make a decision based on anything but what's in front of them. And that sacred encounter between patient and provider seemed like a really important thing to work on behalf of. And frankly, if we do that well, we're driving decision making consistently, but through that lens, everything else still work out. So really thinking carefully about stakeholder and who's driving the ship and who you're working on behalf of is a complicated question in this network business.
If you think about examples of like Airbnb or Uber, they are also platform businesses, right? You've got drivers and you've got people that rides, and then you've got homes and rooms and couches, and you've got people that are looking for places to stay. And if you've got a lot of people that are looking for places to stay but not enough inventory, you're going to be a problem. But if you've got all this inventory but not enough people looking for a place to stay, you're going to have a problem. So there's this inherent dilemma of always trying to keep that as balanced as possible. And then what you just described is a multitude of extra layers of complexity when we're talking about a platform business in healthcare. It's not as simple as that supply and demand side.
Yeah, it's absolutely accurate. I'm convinced that the next company is going to be a SaaS software company where all we have to do is sell to one customer. But yeah, it's complicated, and that's a complicated issue that never goes away, right? In the early days, it's chicken or the egg, right? Like provider didn't care because you don't have the right data source, and the data source didn't care because you don't have the right provider. So you got to overcome the chicken or the egg problem, which I think is that's a moat. A lot of people don't even go into this business because that's such a hard thing to overcome. But to your point, it never changes. Every new product we introduce, we have to take that into consideration. Every new distribution channel that we establish, we have to take that into consideration. We've got to work with our supply side network to make sure that it's important and relevant to what they're trying to accomplish. So yeah, that is as consistent as rain in Seattle.
Yeah. It also is, there's a lot of benefits of that as well, right? Because the more value you can deliver to one side usually ends up multiplying the network effect of the value that you're delivering to the other side. So I've been involved in a couple of these types of business models, and their valuation is 15, 25 times because the pace of being able to scale is so exponential once you figure out that product market fit.
Yeah, hard problems are the ones we're solving, right?
Yeah. So Kyle, if you could just, as we start to kind of wrap up here, thinking about our audience being fellow innovators that are in the trenches at different phases of the commercialization journey, like yourself, or even larger, more established entities in healthcare who are trying to innovate by adopting solutions like yours. What are some of the lessons learned that maybe we haven't already touched on that you would want to share with folks?
I think never underestimate the plumbing, right? Is that if you think about what we're doing at its core level, it's really data connectivity from one stakeholder to the next, from one entity to the next, from one system to the next. It's not the most glamorous work, right? Like we're building infrastructure in a lot of ways, but we're building infrastructure because on behalf of that infrastructure, we're going to be able to, prioritize patient interest in a way that hasn't happened before. So slogging through the data plumbing is how we get to the goal of being able to actually impact patients, both affordability and experience and journey in a way that it hasn't happened before. Because, ultimately, like we talked about, right? Rules made by health plans on one end, decisions made by clinicians on the other end. Today, it's the patient running back and forth between to try and figure that out, right? And so the only way to solve that problem is to do the decidedly unglamorous work of connecting all pipes.
Yeah, very difficult. I'm sure along the way, you probably have second guessed whether this was even possible, whether it's even doable. Are we crazy for even setting out on this mission? And, even just the other stakeholders that you encounter that are, like, this is just too far fetched. We're not there yet. And kind of thinking that, we've got several years more, 5-10 more years to go, whereas kind of like what you're describing, it's happening now because you believed it could.
Yeah, absolutely. We had all those thoughts. We more often than I'd like to admit, we looked at each other like, is this possible? Are we actually going to be able to do this? And we've been at it a long time. It took a while, right? This is not a overnight success. I'm in year 8 The company's been around a long time. We've spent a lot of time building this network and are just at the point where we're making the transition to involve care teams, involve patients directly, and start to create that marketplace type dynamic that's going to make a big difference. But it all required, building the network was a prereq.
Yeah, definitely. Well, it's very exciting. Thank you so much for joining me today and sharing your story with us. Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.